Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Performance anxiety on stage, sports or sex. Performance anxiety is the strong, excessive fear or worry that you will not be able to accomplish something specific, causing emotional distress and physical symptoms. /r/n/r/n. The term is commonly used to describe stage fright, but can be applied to the anticipation of any performance. This includes anxiety caused by the anticipation of sex, called sexual performance anxiety, or extreme worry and fear triggered by an approaching sports event, called athletic performance anxiety. /r/n/r/n. The treatment of performance anxiety most commonly involves talk therapy as well as medications like antidepressants or beta-blockers. /r/n/r/nfstop 123, Getty Imagesrnrn Although the terms are sometimes used interchangeably, anxiety is not the same thing as fear. /r/n/r/n Fear is a short-term response to something specific that threatens you. With anxiety, you respond to the anticipation of something, resulting in longer-lasting distress. While fear is an appropriate response to a present threat, anxiety is more broadly focused and future-oriented. /r/n/r/n Performance anxiety is the anxiety associated with a specific performance. The fears and worries may go well beyond the fear of humiliation, embarrassment, or shame, but also involve the fear of rejection and how the failure might impact your future. /r/n/r/n Performance anxiety often takes root during early childhood, influenced by the expectations and desire for perfection from people around you. The tensions may only emerge in later life as performance anxiety, either occurring abruptly or developing gradually. /r/n/r/n Performance anxiety can be a one-time event, recur occasionally, or get progressively worse. /r/n/r/n Anxiety is a normal response that can occur when you worry about things like health, money, or relationship issues. In some cases, anxiety may be considered healthy, compelling you to work hard and achieve more at school, work, or sports. /r/n/r/n However, if anxiety is persistent, worsening, and interfering with your quality of life, you may very well have an anxiety disorder. /r/n/r/n Anxiety disorders are a group of conditions defined in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5. There are many types of anxiety disorders, including separation anxiety disorder and post-traumatic distress syndrome. /r/n/r/n The term performance anxiety is not an anxiety disorder per se. Rather, it is regarded as a form of social anxiety disorder, SAD, characterized by the fear of social situations. /r/n/r/n In recent years, the DSM-5 added a specifier called a performance-only specifier for individuals with SAD whose anxiety is associated with a specific performance, whether on stage, on the playing field, or in bed. /r/n/r/n In severe cases, a person with performance anxiety may experience an extreme subtype of anxiety called a specific phobia. /r/n/r/n A specific phobia is characterized by an extreme and unreasonable fear associated with a specific object, situation, or concept that poses little or no threat. With performance anxiety, this can manifest with constant rumination, intense anxiety, sleeplessness, and going to extreme lengths to avoid a performance. /r/n/r/n Several personality types are seen to be vulnerable to performance anxiety. According to a 2019 study published in Frontier of Psychology, these traits include /r/n/r/n Performance anxiety symptoms may differ from person to person but often involve both emotional symptoms and somatic symptoms, physical symptoms triggered by emotional distress. /r/n/r/n Emotional symptoms of performance anxiety include /r/n/r/n somatic symptoms of performance anxiety include /r/n/r/n performance anxiety is not a mental disorder classified in the DSM-5. Rather, it is a manifestation of SAD and one that is not always well defined in the medical literature. /r/n/r/n Even so, researchers often break performance anxiety down into three distinct subtypes. /r/n/r/n Stage fright, also known as stage performance anxiety, describes the extreme anxiety experienced by actors, musicians, dancers, speakers, and others who have to perform in public. Even people who have to make a presentation at work can experience stage fright. /r/n/r/n Stage performance anxiety goes beyond simple jitters or butterflies, causing heightened apprehension and a negative emotional state that can interfere with or even sabotage the desired outcome. /r/n/r/n Studies suggest that most stage performers have experienced performance anxiety at some point in their careers. According to a 2019 study in Frontiers of Psychology, 50% to 70% of professional musicians reported compromised performance due to anxiety. /r/n/r/n Anxiety levels can vary based on whether you are in a solo or group performance, there are people of importance in the audience, or the level of skill of fellow performers is high. /r/n/r/n In extreme cases, stage fright can also take the form of glossophobia, characterized by the irrational fear of public speaking. In such cases, a person is more likely to freeze or drop out of a performance at the last minute. /r/n/r/n Athletic performance anxiety is a fear or worry related to a sports competition, typically manifesting with the fear of choking. Choking is a common concern among athletes, amplified by the need to not only perform but to win. This is especially true among elite athletes in whom perfectionism is expected. /r/n/r/n Studies suggest that anywhere from 20% to 34% of elite athletes experience performance anxiety. Among all athletes, the number can be as high as 60%. /r/n/r/n The feelings of anxiety may be amplified by the spectator's response, such as booing, ego threats, or one-chance events, like playoffs. Performance anxiety may be further fueled by the fear of losing it, meaning the feeling that you are falling beneath your own standards. /r/n/r/n Athletic performance anxiety can cause more than emotional and physical symptoms. It can increase the risk of injury among athletes who either overcompensate or are overly distracted during a sports competition. /r/n/r/n Sexual performance anxiety is a fear or worry related to having sex. It can be due to uncertainties about your general ability to satisfy a partner. It may also be related to a negative body image, relationship problems, or other factors. /r/n/r/n According to a 2020 study in Sexual Medicine Review, between 9% and 25% of males and 6% and 16% of females experience sexual performance anxiety. /r/n/r/n Sexual performance can have a cause and effect relationship with sexual dysfunction. Having conditions like erectile dysfunction, ED, premature ejaculation, or dyspareunia, vaginal pain, may fuel feelings of anxiety that only make symptoms worse during sex. /r/n/r/n The desire to have kids can make matters worse by placing the additional pressure of conception atop the need to perform sexually. Cultural or family pressures can further amplify the stress. /r/n/r/n Though not typically regarded as forms of performance anxiety, taking tests and having a job interview can fall under the umbrella insofar as they both involve public exposure, either directly or indirectly. /r/n/r/n With test anxiety, your worries may extend beyond your test results to fears about your future and how others perceive you. The same can occur with interview anxiety, in which a person will often sabotage their chances due to overwhelming feelings of inadequacy. R/n/r/n performance anxiety that occurs as a once-off event may not be of any concern. However, if the feelings are intense, recurring, and undermining your quality of life, you may benefit from seeing a psychologist or psychiatrist. R/n/r/n In such cases, the provider may see if you meet the diagnostic criteria for social anxiety disorder, SAD, described in the DSM-5. R/n/r/n To meet the criteria, you must, R/n/r/n To meet the criteria for SAD, these conditions must persist for more than 6 months with no other explanations. R/n/r/n If the fear is restricted to speaking or performing in public only, SAD would be diagnosed with a performance-only specifier. R/n/r/n Treatment options for performance anxiety depend on the severity of your symptoms. The main form of treatment is talk therapy with or without medications. R/n/r/n Psychotherapy, also known as talk therapy, is the primary form of treatment for social anxiety disorder. Different forms can be used, including R/n/r/n Of these, CBT is the most commonly used for anxiety disorders and often the most effective. It involves identifying and changing negative thought and behavior patterns to develop more effective ways to cope. R/n/r/n SAD is sometimes treated with medications. A common option is a class of antidepressants called selective serotonin reuptake inhibitors, SSRIs. Another class is known as serotonin and norepinephrine reuptake inhibitors, SNRIs. R/n/r/n Beta-blockers are a class of drugs that induce calm by blocking stress hormones called adrenaline and noradrenaline. Benzodiazepines are a class of sedatives used to calm you down and reduce anxiety. R/n/r/n Individual drug agents commonly prescribed for the treatment of SAD include R/n/r/n The prevention of performance anxiety involves preparation. This is true whether you are a speaker, athlete, actor, musician, or planning to engage in sex. R/n/r/n Here are 11 self-tips that can help. R/n/r/n Performance anxiety is an excessive feeling of fear related to not being able to perform well. People with performance anxiety may experience rapid heartbeat, lightheadedness, shallow breathing, sweating, and other symptoms when faced with a situation where they have to perform. R/n/r/n Performance anxiety may occur with public speaking, athletic competition, during sex, or in other similar situations. It can be treated with psychotherapy or medications such as SSRIs or beta-blockers. R/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.